My name is Kira London Nadu, and I am a strategic advisor for the Cannabis and Psychosis Exploring the Link project. I'm joined today by a lovely guest, Stephanie Coronado Montoya, who will introduce herself now. Stephanie, take it away.
Yeah, hi. So I'm a PhD student in biomedical sciences at Université de Montréal. Originally, I come from the States, so I did my studies, my undergraduate studies there in psychology, and then I went on to do a master's in psychiatry, and now I'm working in biomedical sciences, so working more in the cannabis field and psychosis field specifically.
So definitely really up our alley, and I'm sure you'll be teaching us a lot today. So to kind of get us started and to get us having a feel of what you do, can you tell us a little bit about your studies, your research, how things have unfolded, and what interested you in starting this work in the first place?
Yeah, sure. I've been working in research for the majority of my studies, and my work experiences have been very focused both on research and working with vulnerable populations. I've worked with a variety of different populations. So for example, people with developmental disabilities, I used to work with a lot, or people with rare skin diseases called scleroderma, for example, that was also part of my experiences. So I've always been very interested in helping populations that are either underserved or more vulnerable to certain harms, or basically who have less resources, services, programs, things like that. And when I was looking to start to do my PhD studies, I knew I wanted to work in a population where they would be underserved or have less services. And it was about the time when cannabis was legalized in Canada. So the opportunities for cannabis focused programs are great. And I went into a lab that was looking at cannabis and psychosis. And since it was very much in line with my interests, I started a PhD there, and here I am, still here.
So. Amazing, right? And so you and I, when we were speaking, you told me a little bit about the different stages of your PhD, or the different pieces of research that you've done. Can you speak more to that?
Yeah. So essentially, when the cannabis legalization came with a lot of gaps in the knowledge of actually many different areas, but specifically in terms of mental health, we knew that people with psychosis were a very vulnerable population. And so this was going to be the center of my PhD project. And so the first thing I wanted to know was what existed for people with psychosis who use cannabis. And so I did a review of all the literature that had ever been published on this. And essentially to see what's been working out there, what's effective, what parts of these programs are working, how they're doing. So that was the first part of my project. And then the second almost logical step was asking the population itself, what do you guys want? What do you prefer? What kind of services would you want, or what specific components of treatment or intervention services are you interested in? So that was the second part of my project. And then the third final phase of my project is to build an intervention based on their needs, preferences, everything we found out previously based on the components of previous programs that have worked, to build a very novel, but informed both by the patients and informed by the scientific literature, build something that would work hopefully for them, or that would target their needs. So these are the three different phases.
Interesting. And three really kind of linear phases that logically led into one another.
Yeah.
During that second phase of figuring out what people needed, what did folks say to you, or what did you pinpoint during that phase?
Well, it's still in the beginning stages. So we're currently recruiting for this project. So we still don't have the findings in terms of that. But what I can tell you is the method that we're using is a bit innovative for our field, because we're essentially using a marketing method and applying it to psychology. So I think in marketing, one thing that they figured out really well that we don't do enough in research is asking the consumers what they want in terms of their product. And this is very logical, and we all know about consumer research, and there's always surveys and everything. And this is why certain products are so appealing. It's because it was informed by the people who want to use it. Whereas in our interventions, often this is one of the pitfalls where that little component is missing, and it's so small and yet so important. So what we're doing is we're using this method that marketing surveys often use, that essentially asks, you have the same product, and it has different components that will always vary from product to product. And then the patients will answer the survey and say, I prefer this product, which is in fact an intervention. And through our analysis, after our analysis, we'll figure out what exactly are the components that make our product, which is the intervention, more appealing to them. And hopefully by doing this, we'll be able to really pinpoint the really important components, and this will inform the development of our application eventually.
Interesting. And as you said, very innovative. The folks who you're doing this research with, like the folks who you're looking to set up an intervention for and some supports for, are these people who all use cannabis and all have experienced or are experiencing psychosis?
Yeah. So all of those are two main criteria. Is essentially people have to have had a first episode of psychosis and being currently treated at a early intervention services clinic. Mm-hmm. And as well, they have to use cannabis, whether this means having a cannabis use disorder or not. Because as we found out, and this is a bit unfortunate, but as we found out through our systematic review of the literature, there's actually hardly any interventions that exist for this population. And most of the populations are working more towards abstinence, so stopping use altogether. Mm-hmm. And most of the interventions that exist are targeting specifically people with cannabis use disorder. So in terms of harm reduction, there's actually hardly anything going on. And there's still a decent number of people, especially in the psychosis population, there's a lot of cannabis use and it can be very harmful to them. But there's no services that can better address this problem if this is a problem that they want to address.
Interesting. So do you think that this idea of harm reduction, which is also really central to the Cannabis and Psychosis project, do you think that that's still a little bit marginal in the research that you do, in the clinical aspect of what you do?
Yeah. It's surprising how novel it is. I think that really surprised me actually, because it seems, I think, logical. Well, I used to work as an intervention worker with another population, and it was also a population that would use different types of drugs and everything, different substances. And that was one of the things that I learned on the field, was that harm reduction was a lot more effective than just going straight on for abstinence and just telling people, look, stop using this drug. Because as well-intentioned as that is, sometimes that's not what the person wants. Sometimes it's not realistic. Sometimes that's not what the person needs either. So I've been very a big promoter of this type of approach since I've had experience in different fields, and that was the one that seemed to work the most. And so when I came onto this field of cannabis and psychosis, and I saw that wasn't being done much, I was super surprised that, again, while it seems really well-intentioned, it ends up being fairly ambitious to target abstinence specifically, and to not instead tell people, look, you use cannabis, you still want to use cannabis, that's fine, but let's protect everything around that use, Mm-hmm. So that's something that's been surprising to me. And in the literature review that we did, we only found 5 studies that had ever looked at preventive trials. Oh, wow. Yeah, it was, and we did it from the beginning of time till today. So it was super surprising that there were such few studies targeting cannabis and psychosis in a prevention or harm reduction approach. Mm-hmm. And none of them were targeting harms. None of them were targeting the cannabis behaviors. It was all reducing cannabis use. So.
Interesting. And so, well, actually, that leads me to my next question, which is about your findings and about how you're centering harm reduction in your own work, and what kind of other outcomes you're targeting aside from just, reducing your cannabis use.
Well, we're actually not even trying to target reducing cannabis use.
Not even? Okay, interesting.
No,
Mm-hmm.
we've made it because it's the harm reduction aspect of my work. So here I'm talking about the final phase of developing an application, and it's going to be a mobile app for super brief intervention. That's a mobile app for young people with psychosis who use cannabis. And we're not targeting this because we're mainly going for a harm reduction approach, where we want to promote positive behaviors. Essentially, we want to promote a better consumption with less harms to the person, be it in terms of mental health, physical health, legal problems, things like that. So this is our main outcome that we are hoping to see a change in and are really trying to target with our application. And because, again, our population is both people who use cannabis and people who have cannabis use disorder. So there's like two subgroups, people with and without cannabis use disorder. And so not everyone might find it necessary to reduce their cannabis use. It might be less relevant, and they might also not be ready to stop using cannabis.
Totally. That's a very kind of specific and patient-centered, for lack of a better word, or maybe that's a good word, approach. I'll ask about that in a second, but I'm wondering, can you tell us more about this app, and what are some of the concrete harm reduction messages that are included in the app?
Mm-hmm. Mm-hmm. So again, it's a very brief intervention is what we decided to do based on what we see are the needs. And because it's a more of a harm reduction app, we're not necessarily aiming to reduce cannabis use. As I said, it's more, if anything, eventually, ultimately, the goal would be through the use of this app, they go and seek more help if that's what they need, and their actual physical and mental health gets better. So that's part of that. In terms of the harm reduction messages that we're really trying to promote here, it's like I said, there's a lot of behaviors, and this is a lot in line with things that we know about other substances or other harmful behaviors, but there's a lot of behaviors that you can take on while still using the substance that will make it less harmful for you or bring about less consequences. For example, I'm I would say almost addicted to candy. And I know that there's certain things that can be done to make this less harmful for me. For example, eating less candy per day, or having the less sugary ones, or having those made with natural fruits, or same with alcohol. You know that trying to have 5 drinks instead of 7 is already a better idea, or trying to only drink at night is a better idea. So there's a list of protective strategies like this for cannabis too. And so, for example, one of them would be trying to limit your use to weekends only, or trying to only consume at night, or trying not to consume before doing a physical activity. So it's a range of, so as you can see, like it touches on different things, like both limiting your use to avoid having negative consequences after in certain ways. So for example, avoid using in the morning because this would help you in terms of work or school. So you're not stoned at work, you're not stoned at school. So this could bring less problems in terms of work or academic life. Not smoking before driving, for example, that would bring about less legal problems. So there's a number of a list of strategies that are pretty helpful in that sense and don't necessarily target the quantity of cannabis use that you use.
Love that. Yeah. And
Yeah.
it's super concrete, but also super flexible, right?
Mm-hmm.
From one person to another.
Mm-hmm.
And so I'm wondering about this focus that you seem to have in your research on patients, on individuals, on individual goals. Can you tell us more about how you're involving patients in your work?
Mm-hmm. Yeah. Well, the first one is, and I'm clearly very excited by this survey that we're doing because, as I said, so this is just to go back. This is the second phase of my project where we're doing a survey using this marketing strategy. And this to me seems almost intuitive that we should use these strategies, which marketing people already have understood, just including the patients every time. And well, in their case, the consumers, and asking what they want and then doing the product kind of tailored to their wants and needs. So this survey will be a really interesting way and a really great way, first of all, of getting participants involved and getting a voice in the kind of interventions that they want and what they need and what they prefer. And this is something that actually came from my previous work at a lab where we used to work on scleroderma, the focused intervention, so rare skin disease. And so it's a rare skin disease. And so we had many theoretical ideas about what it is that these patients needed based on the literature, based on science and everything. And so we're creating an intervention for them. And then we had this patient advisory committee. And so they would come in and they would look at their content that was targeted for people like them. And then they would tell us, oh, I could never do all of this. I'm too tired, because this is one of the symptoms they often get. So I would be too tired to do this, or that's a problem, but like really my fatigue is a bigger part of the problem, and I don't see anything addressing that. And it's things that we didn't necessarily know about or we hadn't thought about. Like, we're not in their shoes. So it's not easy for us to necessarily address all their needs and preferences or to address it in the way that they would want it. So, and likewise for people with cannabis, with psychosis who use cannabis, this isn't documented very well. Like what their needs are, what their preferences are, what kind of approaches would they like? Would they like it to be a shorter intervention? Would they like it to be a longer intervention? And the thing about the survey that we're doing, it's super informative for the researchers, and it's basically documenting this. So then all future interventions will just build on this. They'll finally know. And another advantage of that is the more we tailor it to the specific population we're working on, the greater the chances are that the patients will actually use it. You know, if we offer them an intervention that's 8 months long every single day, who's going to want to do that? Even if it's fantastic, even if it's awesome, even if you get $2 per day, if it doesn't tailor their needs, like, why would that be interesting? You know, so, and it's a waste of resources finally. So.
Yeah, no kidding. And you also mentioned that patient retention, or maybe not patient retention, but retention in treatment, if that's the correct term. I'm not a clinician, so please do correct me. But is tricky with this group of folks.
Yep.
Is that accurate?
Yeah. Essentially, a really large problem here is, and this is again one of the things that I'm hoping that will come across, if anything at all, in this video, but also through the survey that we're doing, is that getting patients involved is very, very critical. Because first of all, we're getting their opinions. Yeah, that's great, and we're going to document this, and it's going to increase hopefully the engagement of patients in future research studies. We're hoping for that. But it's something that is a recurring problem in all of the studies for people with psychosis. And it's unfortunate because there are programs that exist and there are interventions, but the number of patients who go and stick to it is very low because there's very low levels of motivation there. And so it's difficult to actually be able to help people if they're not showing up. So that part, we're hoping to, hence why this kind of survey is very, very important, is because we hope that by targeting specifically their desires, we'll be able to attract more people and hopefully be able to help them more.
Right, and this makes sense, right? Like the conversation doesn't just stop at, well, people aren't showing up. The conversation continues into, why aren't people showing up? What can we do differently? How are we not meeting people's needs? And maybe that's why they're not showing up. Yeah, that's a very logical way to do it. But I know also myself being a researcher that sometimes different pressures of the research make it so that we want to get right into that phase 3, you know, the creating the application, creating the harm reduction messaging and everything. So it's really cool that you've taken the time to build, to really ask folks what they want first. And I'm wondering, throughout this journey, your studies, your work, your personal experiences, has there been anything surprising? Have there been any kind of myths or misconceptions that you had, either about psychosis, about cannabis use, about the link between the two? Anything that surprised you, or anything that you realized that your previous conception was incorrect?
Yeah, well, so I've been working with vulnerable populations for years, but they've always been very vulnerable populations. So a lot of the work I've done in my doctoral studies has been actually constantly a surprise because I'm just learning all the time. And there are some misconceptions that I had that going into the research, I was like, oh, okay, well, I didn't know that. And that's super interesting. And let's keep informing people about this. So one of the first ones would be in terms of the link between cannabis and psychosis. I thought it was going to be clear cut. I thought there were no questions about this. And the more I delve into it and the more I look into very detailed meta-analyses and systematic reviews, I'm understanding that the answer is not really that clear. And that many researchers, though they think there's maybe a connection here in one way, in one direction or the other, it's really not clear yet. And I guess this is one part that I like about science, is that they're honest enough to say, like, okay, well, we're not sure about the direction, but it's potentially from cannabis to psychosis and potentially from psychosis to cannabis. And there's potentially a link in between that biological or chemical. So it's a little bit not misunderstood, but not well understood just yet. And so that was very surprising to me to just say, so for example, to hear people say like, oh, cannabis causes psychosis, and to be like, okay, well, it's not that clear. You know, we're not sure yet. We have a lot of information on this, and there's a lot of interesting studies, but it's not that simple either. I think another misconception that I had, and I guess this one seems silly now in retrospect, but it's in terms of the cannabis use. I, much like with other drug use, I just kind of assumed that if you're using cannabis and you're already vulnerable, so having a severe mental health disorder, for example, it would be a cannabis use disorder immediately, right? And knowing that people with psychosis can use cannabis without having a cannabis use disorder, and still wanting to use cannabis because for other reasons not related to psychosis at all. This part I was not aware of before. So, and that's when my projects, which target people who use cannabis but don't have a cannabis use disorder, I think this part's interesting because there are no services for people who want to continue using cannabis and not necessarily, not reduce, but just maybe like better manage their consumption and everything.
Yeah, absolutely. I think, this common thread in what you're saying is just how complex these things are, and why, by the way, we spend so much time exploring the link between cannabis and psychosis, which is the name of our group. So of course I needed to plug that in. But I'm wondering, I'm really interested in this complex relationship and how the link may be bidirectional, may be bidirectional, so from cannabis to psychosis and from psychosis to cannabis, and might also involve a bunch of other factors. And I'm wondering, how are you hearing the conversations around cannabis and psychosis in general? Like, who do you think, if anyone, is trying to simplify it? Where are you seeing maybe oversimplified messages? And or maybe the most misunderstanding, and a good place for us to kind of further educate folks about how complicated this all is.
Yeah, I think generally, well, okay, so cannabis use is already stigmatized, right? So I think this is one of the harder parts, and especially amongst those who will continue to stigmatize, is explaining that, okay, first of all, the cannabis didn't necessarily cause the psychosis, and maybe the use of cannabis by a person who has psychosis, maybe it's not just bad behavior. Maybe there was like a tendency already for that to happen, and it just is part of it, and we can accompany people and like to have less harmful behaviors associated to that. So I find, in terms of conversations, I would say more in the general population, where I see a lot of misconceptions and a lot of like oversimplification of this direction, which makes sense too, because we've been hearing for a long time the simple message that weed is bad, just simple as that. Weed is bad, and it like just now in these recent years we've been exploring more the benefits of cannabis, and for example cannabidiol, and what can it do and how can it help, and these are things that are more recent, and it goes against a lot of what I think the general population was hearing of, just weed is bad and it causes problems, and if you're a stoner this is terrible or whatever. There's a lot of how can I say misconceptions about it in that kind of, in just the general population, I would say. So in terms of education, I would say yes, definitely general population needs to hear a little bit more about how even the scientific community is not really sure yet about what the direction is.
Totally. I would definitely echo that from my point of view as a researcher and somebody who tries to do drug education too, is that, of course, for public health, simple, straightforward messaging is the best, right? Right now, with the COVID-19 pandemic, that's what we're looking for. Simple, clear messages: wash your hands for 20 seconds, wear a mask, etc. But when it comes to harm reduction, for example, for cannabis and psychosis, or for cannabis and your mental health in general, you have to have a conversation almost. It's hard to do
Mm-hmm.
really specific public health messaging. And yeah, so I definitely really relate to that. And I do think that there's still a lot of work to be
And
done.
yeah, I think there's also just to jump in there, but one thing that you said, I think it's one of the merits of Canada actually legalizing cannabis was just opening up the doors to further explore this and to see, okay, well, what are the potential harms? What are the potential benefits of cannabis? How can we protect people who are getting harmed from this substance? Because that wasn't existing before. And how can we protect them? Because I think maybe had cannabis been illegal here in Canada, it would have been a little bit more complicated to promote a harm reduction approach because it's illegal. So why are we telling them to continue using cannabis if it's not allowed? And how, on top of that, why will participants come forward and be like, "Hey, I smoke. I know it's illegal, but include me in your study." So it's just really open doors for us to finally be able to address the problem from a much more realistic approach and to
Mhm.
be able to reach people who might actually be looking for this kind of intervention or program.
Yeah, yeah, absolutely. I would totally agree. I mean, also, this project is funded through the SUOP program of Health Canada. Thanks, Health Canada. Um, and that happened because of legalization, right? So we're able to showcase, for example, the stories of people who have gone through psychosis as a result of their cannabis use and how different that is from one person to another. Different, for example, on how they can continue to use cannabis after their episode.
Mhm.
Some people, it just does not work for them at all, and they don't use anymore. And then other people can still use kind of maybe more mindfully using harm reduction. So
Mhm.
um, it's yeah, for sure, really complex, and these conversations are just um, crucial to really getting to the bottom of it.
And I
Um,
think as you're mentioning now, I'm thinking about one of the most surprising things I think I found through my research was the reasons for cannabis use in people with psychosis. Because a lot of, I would say, both from the scientific community and the general population, I would hear, oh yeah, often people who have psychotic disorders, for example, self-medicate. So to me, hearing that, oh, self-medication, I was like, oh, okay, that must be true. I guess it makes sense. It made sense as an explanation and everything. And then when you actually look into the research, most of the people with psychosis who use cannabis use it for the same exact reasons that people without psychosis use it, right? Which I find is super interesting because it makes me think, okay, well then again, maybe abstinence is not the solution. Maybe they're using it for pleasure or out of boredom or to get high, just simply, and maybe we're pushing the wrong kind of services, not knowing, thinking that we're doing the right thing, but actually targeting the wrong problem.
right. That's
Mm-hmm.
super interesting. I
Mm-hmm.
don't think I knew that.
Yeah,
I'm
yeah.
really glad that you do.
I was very surprised when I heard that.
Right. Yeah. Fascinating. Um, so I have just two last questions for you. The first one is contextual. So of course we won't be in this pandemic and this crisis forever, but for now we do want to speak about how the COVID-19 crisis is affecting um, this work. So I'm wondering
Mhm,
if you've seen any effects of this crisis in your research or other aspects of your work.
mhm, mhm. Well, there's definitely been an effect because we had to stop recruiting for the patient survey, which was really unfortunate. So we had to stop recruiting for a number of months. However, this has pushed us to amp up our recruitment methods. So it went from a Quebec study to a pan Canadian study in order to actually be able to speak to more will have more different diverse opinions throughout Canada in different contexts and provinces, essentially. So while it was kind of negative for us at first, it actually allowed us to expand the kind of survey we were looking at. So that was actually ultimately not as bad as we thought it would be. In terms of, however, the population, there has been more documented cannabis use or substance use in general, which has been really unfortunate. And in people with psychosis, there tends to be not just cannabis use, but other substance use. So this has been a bit unfortunate, the increase in substance use, because it comes with complications for physical and mental health. There's been less access to services. One, less access to services because of the pandemic in general, but two, less people going to the services. So it can be a population that, is more isolated and has harder access to resources as it is. And this pandemic just made it a little bit harder, that much harder, not just to recruit participants, but to be able to have such easy access and to speak to them and to involve them in research. And so that's going to be, I think, an ongoing challenge because of the pandemic. And hopefully it won't be too bad. It won't affect the participants or the population too much, and they'll still be able to find the motivation to go and participate in studies that might be very beneficial for them.
Yeah, definitely. And especially thinking back to what you've mentioned already about patient care and patient involvement and retention in treatment or in different harm reduction interventions. So yeah, certainly this crisis, this pandemic is very far-reaching, affects a lot of aspects of our lives. So yeah, we tried to adapt. And I'm happy to hear about the adaptation in terms of making your research pan-Canadian.
Yeah. It's been good. It's been good because we've not only made the survey pan-Canadian, but now it's opened our access up to other Canadian sites. So for the application that we're developing and we're going to eventually test in a clinical trial, this will also become pan-Canadian. And so it's really great because we'll have a variety of opinions, and the Quebec province has its own context and the other provinces have their own context. So it'll be really great to have a more generalizable kind of perspective on what works, what doesn't work, what people think.
Yeah, I love that. That's a really fortunate twist, I would say.
Yeah, it's not all bad ish.
Yeah, we can make meaningful things happen for sure. And so to kind of finish us off, I'm wondering if you have any final thoughts about this subject or final takeaways for folks who would be watching this.
I guess just as a general harm reduction message, I would say that for those people who continue to use cannabis even after having psychosis, it doesn't, there might be a lot of people who say, okay, you should stop in, and it's easier. First of all, it's easier said than done. Second of all, you might not want that, but there's so many strategies that you can apply that are either evidence-based or anecdotal, but still can probably protect you from a lot of harms. And so it's getting, being aware of these strategies and trying to apply them as much as you want, or trying to apply just one, and it'll already improve your life by just that much, So I think that's one of the most important things I think that we don't hear enough about, unfortunately. We often hear black and white messages like, just don't do drugs. And who does that work for? I mean, it works for a lot of people, but not everybody, And so to be able to become more aware of these other messages that can actually be super helpful and that can help you prevent problems in school or at work or with your family or legal problems or things like that. I think it's something that should just be more generally known in the public, especially for cannabis users.
Amazing. I think that's a great way to end it. Thank you, Stephanie, so much. This has been really informative. I've learned new things, and I'm sure that the people who will be watching will learn new things too. Thank you so much for your time.
Great. Well, thanks for having me.